Welcome to Unapologetically Sensitive, where you can learn, relate, laugh, and maybe even live a bolder, brighter life. I'm your host, Patricia Young. This is a weekly podcast where we explore the strengths we have because of our sensitivity and some of the challenges it poses as well. The information in this podcast is not a substitute for help from a licensed mental health professional. Hey there. To the creatives, healers, sensitives, and deep thinkers, welcome. How are you doing? We are mid-February right now, so how's it going? How's the year? How are you hanging in there? Today I'm talking with Dr. Lindsay Gibson, who has been a guest 2 times before. If you have not heard her talk about adult children of emotionally immature parents, she does talk briefly about it in the beginning about what that is, but you might want to go back to episode 43, which is called What is an Emotionally Immature Parent and How to Identify a Healthy Relationship. And then I had her back on as a guest for episode 88, How to Identify Healthy Relationships. Her episodes are the most popular. She's got best-selling books. I think you're really going to enjoy this. She talks about her new book, which is Self-Care for Adult Children of Emotionally Immature Parents. We talk about how she sees sensitivity as a trait possibly affecting a person's functioning. We talk about adult children of emotionally immature parents being taught not to trust themselves or their self-awareness, how to have emotional protection, how to work with your inner connection, and how do these issues affect a person's choices and behaviors in relationships. I think it's a really rich episode that you're going to enjoy. It's always a pleasure to have Dr. Gibson on as a guest. Now, if you go back to episode 43, I call Dr. Gibson Dr. Green, which is wrong. I spoke to her about this when I realized that I'd made the mistake. And when we talked about it today, she didn't even remember me doing it, but I have a need to just call myself out on it. Let me tell you a little bit about Dr. Lindsay Gibson. She's been a licensed clinical psychologist for over 30 years and specializes in individual adult psychotherapy with adult children of emotionally immature parents. She's the author of 4 books. Her book, Adult Children of Emotionally Immature Parents, remains a #1 Amazon bestseller. The follow-up to this book is Recovering from Emotionally Immature Parents, and the second edition of her first book, Who You Were Meant to Be, has been recently released on Amazon. Her latest book, Self-Care for Adult Children of Emotionally Immature Parents, was just released in September of 2021. In the past, Dr. Gibson has served as an adjunct assistant professor teaching doctoral psychology students, and she writes a monthly well-being column for Tidewater Women magazine in Virginia Beach, Virginia. I think you're really going to enjoy this episode, so let's just get to it. And now, on to the show. Hey, Lindsay, welcome.
Hi, Patricia. It's good to be back.
I am so excited to talk to you. You know, everybody loves your episodes. I'd just love to have you on every week as a guest because people love hearing what you have to say.
Thank you. Well, let me just get my schedule book and we'll do that.
Hey, anytime you want to come back, I would love to have you as a regular guest. So maybe we should talk about this if that works for you. I want to jump right in. Can you talk about what is an adult child of an emotionally immature parent if somebody is a brand new listener?
Okay. Well, adult child is self-explanatory. And I wish as a culture we had another word for that. We don't have one yet, and I haven't been able to coin one, but you're an adult and you're a child of your parents. The emotionally immature parent is a concept that I came up with a number of years ago before my first book. And I arrived at that term because I was describing what I was seeing in the family members and the people in the lives of my clients. These were people who they were describing to me, and I was thinking, wow, their behavior sounds just like a 4-year-old or like a 10-year-old or a 15-year-old. But doesn't sound like a grown person. And I then referred back to my training in psychological testing, which was very concentrated on developmental levels. The idea was that the person who requested the testing wanted to know, where would you peg this person in terms of their developmental maturity? So are we working with a grown-up? Are we working with a teenager, emotionally speaking? Or is this person pretty primitive in the sense that emotionally they're functioning as an impulsive toddler? So that's where I got my interest in the topic. And then I became fascinated by what happens when the parent is emotionally immature and then stays that way, and their child actually develops further than they did, so that more emotionally mature child, adult child now, was coming to see me to figure out how to deal with their parents' behavior. And as I thought about this and researched about this, I realized that there was a set of characteristics which are quite lengthy. I won't go into all that today because that's not exactly our topic, but there are a few hallmarks of emotional immaturity that capture everybody who falls into this category. And I want to mention, too, that terms like narcissistic personality, antisocial personality, obsessive compulsive, borderline, I mean, all these DSM 5 diagnoses are types of personality disorders that would fall under the umbrella of emotional immaturity. But emotional immaturity is more general and it's less pejorative than a psychiatric diagnosis. And I think people are more willing to sort of accept that less pejorative term that's more descriptive and therefore more useful, because it says, here's what the problem is. It's not that they're a narcissist 100% of the time. It's that their personality structure and their self-development has not continued apace with their chronological age. Okay. So when you think about emotional immaturity, the biggest thing is that they really don't have a lot of good empathy. Their sensitivity to other people is constrained by their extreme self-centeredness. And I like to use the word self-preoccupation as opposed to calling them narcissistic or other terms like that, because in some ways they're like a person who is ill or a person who is injured or a person who is traumatized. Those states, those hurts from the past will make anybody immature, mature, it'll make anybody regress and use coping mechanisms that are more childlike. Okay, so they aren't empathetic because they're bad or they're mean. They just can't get their mind off of their own problems and their own needs. So they tend to be very self-absorbed and self-preoccupied. They also are not self-reflective, meaning that if they do something that upsets another person or creates a problem in a relationship, it doesn't occur to them to wonder what they may have done. They don't reflect on the past and their behavior and say, gee, I wonder if maybe I did something there. That doesn't occur to them, because emotionally immature people tend to be very externally oriented, even if they're quiet introverts. They tend to see the problem as being out there, and they are being victimized or treated badly by what's going on out there. They're being misunderstood. That's a big one. So it makes it real hard to change your behavior or improve your behavior in relationships when you're not able to look at yourself in an objective way. Okay. And then finally, they are terrified of emotional intimacy. This is such a hallmark of them, and it creates so many problems and so many hurt feelings in the relationships between anybody and an emotionally immature person. The definition of emotional intimacy is that each person feels free and open to share what is really going on with them. It's just a true statement about my inner state, my subjective experience. So if I tell you how I'm really feeling or how something affected me, or if I tell you how joyful I am today or how happy I am that something happened, that's emotional intimacy because I'm allowing you to know me at the most real, intimate, internal level. Okay. But when the children of these emotionally immature parents try to do that with their parent, try to be either known by their parent, seen by their parent, or they try to get to know their parent, that really stirs up the emotionally immature person's defenses. I call them EIPs for short. It's any emotionally immature person. It stirs up their defenses, and they have to do something to bring it back to a more superficial level or steer it into conflict, which will break the intimacy bond and make them feel more comfortable. So, those characteristics, the lack of empathy, the self centeredness, the poor self reflection, and the fear of emotional intimacy are kind of the hallmarks of emotional immaturity. And on top of that and out of that, there can come all different styles. Okay, they look very, very different on the surface. But in terms of their personality structure, they are very similar and they have the same effects on their children, no matter what their outside style is. That's a mouthful, but I hope that gives your listeners an overview of what we're doing here.
No, that's perfect. Yeah, thank you very much. Let's move forward. So, your newest book, Self Care for Adult Children of Emotionally Immature Parents, what prompted you to write this book?
Well, what I've noticed in the people that I work with, the adult children of these parents, is that they have a lot of trouble putting themselves first. I mean, I'm talking about a healthy putting yourself first. And they had trouble with emotional self protection. That is, not only protecting themselves physically, everybody does pretty well with that, but protecting themselves emotionally. These children, these adult children, would go into situations and it just wouldn't occur to them that their feelings were important or that their mistreatment was something to stay away from. They just didn't think of themselves as very high on the pecking order. And so they wouldn't take care of themselves in the way that another person whose parents were more mature and who encouraged their children to think about themselves would do. So I wanted to write, well, two things. I wanted to write a book to address self care, but also to provide self care. So the book is structured in a way that it gives you a relaxing, enjoyable entertainment, hopefully, experience by reading the book. Because there are, gosh, I think it's like 76 little short insight pieces. They're no more than 2 or 3 pages long. And so you can dive in and get a little hit of insight or a little bit of hopefully wisdom. And it just fills you up a little bit. It's taking a moment for your self care to give yourself this little break. And they're great for reading right before you go to sleep, reading while you're waiting at the doctor. You don't have to do the commitment of, I bought this book, I'm going to read it all the way to the end. You can just find what's interesting to you and turn to that for, yeah, a moment with yourself.
They're great reminders. They're just little short things, and you can look through the table of contents and pull something out that's relevant and just focus on that. I was looking at it last night in preparation for the interview. I'll share later on. I'm reluctant to share now because it was specific, and I think it's going to make people think that this isn't what your book is about. So I'll hold off with my insight. But yeah, I highly recommend the book, and your other books have done very, very well. And I have people coming to me all the time telling me how much they love your work.
Oh, thank you.
So your book has three main sections. What are they and what can readers expect to get from each topic? And why might adult children find these topics especially meaningful?
Yeah. Well, the first section is called Protecting and Caring for Yourself. And I already mentioned a little bit about that. Emotionally immature parents have this thing they do where if you bring into a situation your concerns or your feelings or your fears or your needs, they kind of get offended. It's like, why are you creating a problem here with interjecting yourself into the situation? So people tend to learn that their needs are a bother to other people, that they're a nuisance, that they're too much, that they demand too much time. And so they don't care for themselves in the way that normal, healthy people will really stand up for and protect themselves. I don't mean in a super aggressive, assertive way, but just, like I count too. Like what I want matters too. Or I expect to be heard for what my needs are in this situation. The adult children of emotionally mature parents are not encouraged to do that as children. In fact, they're frankly discouraged from doing that. So the first section is about that need to emotionally self protect and to care for yourself, especially when you're with people who are only going to be thinking of themselves essentially and are going to give minimal attention, if any, to what it is that you need. So that's the first section. That's the first thing we want to be able to do. And that has a lot in there about honoring your inner world, seeing your subjectivity as highly important. It is the center of your life, like it or not. You may want to be self sacrificing and all that, but your inner world is it's your energy cell, it's your essence. Okay. And you can't go through life without your essence. So that first section will address that. The second section is about dealing with people. This is also something that people get wounded in with these kinds of parents. They know how to be dominated. They know how to put other people's needs first. They know how to think of the other person as the most important person in the relationship and themselves as secondary. They know how to do that. They've been trained, but they don't know how to look for people who are both respectful and nurturing. Okay. They tend to get into relationships fast with anybody who pays attention to them and wants to, well, really essentially shows interest in them because that's something that they may have missed from these parents. And there are a few things in there about dating and parenting, also important relationships. You may not have picked up on or gotten the advice on if you had emotionally immature parents. And then lastly, coping with challenges. Now, one of the things that emotionally immature parents do is they leave their kids to deal with life on their own. I mean, they take them to school, they pay the rent, they tell them to say please, they do that kind of stuff, but they don't really tune in to the fact that these little people of theirs have never been on this planet before. And they don't know what to do, literally, do not know what to do, what next step to take when they're facing a challenge or a problem. And the sensitive parent will be tuned in to the child's confusion or fear or nervousness. Okay, they'll see it, they'll feel it because they have empathy, and they will assist the child through those unpleasant feelings and give them some, tricks of the trade, the rules of the road. Like when you feel that way, just think about this, or make sure that you have all your stuff in order. They'll teach them how to deal with challenges. But that doesn't occur to the emotionally immature parent. They kind of look at children as like themselves. They look at everybody as like themselves, part of the problem. But they allow their children to become emotionally overwhelmed by problems. And then they get angry with their kids when they don't solve the problems very well. It's like, why didn't you know not to do that? It's like, because you never taught me, but somehow the emotionally mature parent just doesn't get that piece, probably because they didn't have anybody help them. And going through life feeling overstimulated and overwhelmed was what they did too. So they may not even notice that happening in their child. So those are the three areas that I felt were very important for the adult children. I call them ACEIPs as an acronym, for the ACEIPs to get some support and get some instruction in an insightful way.
Yeah. I don't know about you, but I find very frequently that clients come to me and they're like, I don't even know what I'm thinking. I don't know what I'm feeling. I don't know what I want. My whole life has been about tuning into everybody else. And a number of the women that come to work with me have launched their kids, and now they're in this place of like, who am I? What do I even want or need? And because their needs were never attuned to and their feelings weren't attuned to, they just think everything is their fault because they haven't even known what a healthy, reciprocal, empathic, caring relationship looks like. And so they find themselves in these relationships that are incredibly unsatisfying because they didn't even know that anything existed beyond that.
Yeah, absolutely. And it's a true handicap.
Yeah. How do you see sensitivity as a trait possibly affecting a person's functioning in these areas?
Well, there are two ways to think about that. One is from the parent, and the other is for the adult child. But what you said just a moment ago about these people that come to you don't know how to put even their feelings into words, and they may not know how to define the problem, again, because they haven't had somebody reflect the feelings to them and use words. But worse than that is the fact that they haven't had a parent who was sensitive enough to read that child's body language, facial expression, demeanor, movements, and guess at what the child might be experiencing inside. Okay? Because children don't come equipped with an emotional vocabulary. They have sensations, but if you don't teach them that something is sad or something is mad or something is joy, they don't go around using those words. Okay. There are like four main body sensations, and it's all the combinations of those body sensations that make up what we call emotions. And somebody has got to label those. And a sensitive parent will say, honey, you don't look so good today. Is something bothering you? And the child goes, oh, this feeling is called being bothered by something. Yes, now I'm getting a word for it, and I'm being encouraged to try to use language about it as a way of helping me. The parent is stepping in with that kind of assistance. In some of the pivotal attachment research by Mary Ainsworth with Between Mothers and Babies, she uses that word sensitive about the mothers who create secure attachments. Sensitivity is not a luxury. It's not an add-on. It is the foundation of the mother-child bond. Okay, so sensitivity is incredibly important for the genesis of the whole emotional life of that child, of those kinds of parents. Now, from the standpoint of the adult child, some children who are very sensitive come into that family and they are processing a tremendous amount of information. You have talked about the processing drive of a sensitive person. Well, the internalizing type of emotionally adult children of these parents, the processing drive in them is tremendous because this internalizer type, the kind that takes it in and processes it, is extremely perceptive and extremely sensitive.
Mm-hmm.
And they need to do something with this swarm of information that they are taking in because they're driven to perceive. They often stay in a state of overwhelm. because neurologically, their brains can't stop perceiving. They're just interested. They're fascinated by stuff. They're taking it in, and then they have to do something with it. And so when you have a sensitive child that is trying to process their internal experiences and get some order on them, and you put them with a parent who's not very well integrated inside, whose personality structure is kind of in pieces. One minute they're this way, another minute they're the other way. They're kind of like little children in that way. They can be very inconsistent. They can be very confusing. Okay, so you take a sensitive, perceptive child and you put them in a family where the parents are acting that way, where the parents are impulsive and inconsistent. It's very, very hard on that little kid's nervous system. Okay. They have to use a lot of energy to just kind of keep themselves in balance when they're in that kind of environment. Winnicott, who was one of the founding psychoanalysts who researched mother-baby relationships, talked about the holding environment and how important that was for the best possible development. And what he meant was that the mother creates not only a holding environment with her arms, but she creates an aura or an atmosphere of holding by being consistent, by always looking out for the needs of the child, being protective, being interested. And without that, the sensitive child really feels stranded. There can be a lot of emotional loneliness in people who have that kind of parent when they themselves are very sensitive. So I really see that sensitive, internalizing people suffer a lot from having parents like this. Also because they want to connect, they have a very deep capacity for love and connection, but they can't get that emotional intimacy going with their parent. And that's incredibly frustrating and alienating to them. They end up feeling alone and excluded a lot of the times for that reason.
Yeah, and I think that also creates a sense of existential loneliness if there's not really ever a safe place for you to fall. And so when things get difficult, either you ping pong around trying to find someone who's going to create space for safety, or you isolate because there wasn't anybody that was ever there who could hold space for you. So you just know that you have to withdraw until you can regulate and re-enter the world. So it can really be a tough place.
Yes, and that withdrawing is so it's so incredibly wonderful that kids can do that, that they instinctively know not to go and get hurt again by a refusal from an adult, but they learn to go inside themselves and create that space. And sometimes, fortunately, they learn to talk to themselves, to coach themselves through situations. Yeah, it's a blessing, really, that they can do that.
It's amazing how adaptive kids can be and the mind can be when we're in environments that don't serve us. The challenge is when you get to be an adult and those adaptive mechanisms are no longer serving you and they end up becoming hurtful because they were protective, and now you're not getting what you want in your life because it's not really an open system, which is usually when people come to get help.
You said that so well. Yeah.
Yeah. And we get these defensive mechanisms because they kept us safe. There's nothing wrong with it. But how's it working for you now? And are you getting what you want? And are you satisfied and fulfilled? And if you're not, then maybe you want to take a look at that.
Yeah, absolutely.
Yeah. In the book, you've talked about the importance of emotional self-protection. Can you explain what that means? And if you have any specific examples, because I think this is a huge one for people that feel deeply. We show up authentically with our heart on our sleeves and we keep getting slapped in the face and we don't know what to do about it. And I think part of that is the expectation, that young part that keeps expecting a parent to show up in a way that they never did. And so we keep expecting people to show up in a way that they never have, because that little part is like, I just want to be seen and heard and loved.
Yes. And isn't it wonderful in a way that little part never loses hope? I call that the healing fantasy, that one day, my parent will be able to have a close relationship with me and will be interested in what's going on with me and will reach out to me with comfort. That's the hope. And it's painful to watch, but thank goodness that little part in them is still alive and well after all that refusal.
Mm-hmm.
Yeah. Unfortunately, it does keep you going back for more hurt.
Mm-hmm.
So
Mm-hmm.
sometimes, emotional self protection means that we protect against some of those, ordinarily beneficial adaptations in childhood that actually will end up hurting you as an adult when you keep going in blindly, as if a little 5-year-old had taken over your entire worldview. You're
Mm-hmm.
right back doing what you did when you were a hopeful little kid.
Mm-hmm.
But in order to be emotionally self protective, I just wanted to mention a couple of things that are really important, just practically speaking. That first, you have to realize and basically notice that you have your own subjectivity. That's an abstract word, but what it means is that you are the subject of your life. You are the subject of your body, of your personality. You have to notice that that's there, that you're having feelings and thoughts, that experiences are happening internally as well. And then once you've learned how to notice it, then you can start taking your feelings seriously. I tell all my clients, there are no small feelings. There are no small or silly issues. They're all coming from a healthy part of the self that wants to be heard and wants to help you solve some kind of problem from the past. That's where all symptoms come from. And then people can learn the ways that the EIP in their life affects their mood, their self confidence, even their sense of autonomy. I mean, I know people who won't do something when their parents are 3,000 miles away because they can tell you exactly how the parent would react to that. And so they kind of self censor and
Mm-hmm.
they don't let themselves do things that they know their parents wouldn't like. So we have to guard against that. But first of all, you have to know what that thing was so you can proceed on to give yourself a choice. Maybe
Mm-hmm.
even if I know my parents won't like it, maybe I'll choose to do it anyway because it's my life. Okay.
Mm-hmm.
And then finally, everybody has to develop their own relationship to how they're going to go about boundary setting with other people. Now, there's a lot of, or there has been a lot of emphasis on this kind of assertive, extroverted approach to limit setting where you say what you want and you stick by it and you hang tough. But a lot of people don't have personalities that fit that very well. Some
Mm-hmm.
people are quiet, some people don't like confrontation, some people are naturally polite and kind and sweet. Okay. That doesn't fit them very well. So everybody has to learn what ways work best for them when it comes to setting limits on the behavior and the requests and the demands of emotionally immature people. Because emotionally immature people do not like boundaries. The boundaries are like kryptonite, especially to narcissistic types. They don't like it at all. They take it very personally. So you have to learn a way not only of how to set the boundary in the first place, but you have to also learn a way that you can sustain because it fits your personality style. That is extremely important. And I think it's often overlooked because in the American culture, we just say, well, just tell them what you think, and that doesn't work well for everybody.
Yeah. I find too that as people start to identify their feelings, there tends to be this way that we minimize. We either do comparative suffering. Well, how can I feel bad when somebody else has it worse? And it's like your feelings are just valid because they're your feelings. or this tendency to minimize our feelings or to justify why somebody said or did something that was unkind. And if you're feeling that it hurt your feelings, it hurt your feelings. And I can tell you, here comes my self-disclosure. Today, I'm putting on my big girl panties in two situations that I was in a group and somebody said something that was unkind and unnecessary, very minor. And I sat and processed it for a few weeks. And I thought I could just manage it and I wasn't going to bring it to the group because, this is just me having a reaction. And last night I got really clear that I need to say something. And my people pleasing is coming up because I posted in this group that we're in to say, hey, I need to talk about something that happened. I didn't want anybody to feel blindsided. So a few people have reached out to me and I'm finding that tendency of wanting to smooth things over, to make everybody feel, oh, I hope you're doing okay. I hope everything, and the truth is what was said was not okay. I'm not okay with it. And I tend to show up in a way to really do a lot of people pleasing, a lot of nodding in group and supportive. It's a lot of work. And I'm really clear now in this group what my needs are and what I'm going to get out of this group. And then I'm going to change and I'm not going to do that people pleasing. And I need to say that this was not okay. And in terms of emotional protection, I will show up and participate, but I am not going to go to this group for things that are meaningful and significant because the people that are in it, not everybody, don't have the ability to be insightful enough to know that when you share something that's not related to what's going on that could be potentially hurtful. And it's important for me to be able to say, this wasn't okay, and to not make anybody feel comfortable around it. I think that's such a huge part of healing. This may not be everybody's path. And yeah, I'm just going to keep repeating myself if I keep talking.
Well, you use that word or that term people pleasing. And,
Mm-hmm.
I think people use that in a kind of a critical way toward themselves, like I'm a people pleaser. And I don't look at it that way at all. And I very rarely use that term because it sort of blames the victim, I think. The reason
Mm-hmm.
that you quote people please is that you're scared.
Mm-hmm.
Okay. You have to find a way of dealing with the fear of what the other people are going to do. That's a legitimate thing to deal with. Okay. So if you have a catchy phrase like people pleasing that sounds like it captures what you're doing, but it does it in a way that's unkind to the complexity of why you do that, then I say, let's get rid of that term. Let's stop
Mm-hmm.
blaming ourselves for being people pleasers. And let's look at what happened to us to make us so nervous about other people's reactions to us.
And feeling responsible for making other people feel comfortable. You said something that was unkind. I'm going to tell you about it. And now I don't want you to feel uncomfortable. That's a lot of work on my part, as opposed to saying, I need to let you know that wasn't okay,
Mhm.
period, end stop. And if people get uncomfortable, not my responsibility.
But you will feel the responsibility if you are a sensitive person. There's no way
Mm-hmm.
around that. You can't turn off your reactions. You have to learn how to work with them and legitimatize them, but find ways to do it so that you feel less guilty about how you told them. And there are
Mm-hmm.
lots of nice ways to communicate that, but we're not taught them. We're taught this kind of brash, in your face, I didn't like that, confrontive approach. And then we have to deal with the fact that the other person gets scared. And we can feel that. So we notice that. And then we feel bad because we didn't want to make them feel awful. We just wanted them to know what the problem was, right?
Right.
So it's very important for us to find ways, maybe find a friend who always seems to be able to move through those kinds of situations gracefully or in a way that keeps other people feeling friendly toward them, that people don't get upset when they tell them something, and learn from people that have that style. Because if you're too aggressive and you're sensitive and you're empathic, you're going to feel bad afterwards.
I think it's going to be uncomfortable either way. What I see more of is the person who minimizes himself. I know I'm taking this seriously. I know you didn't mean it. I'm sure it wasn't your intention. I know I had this big reaction of not putting any of that responsibility of saying, I need to let you know that what you said felt hurtful to
Yeah,
me. I had a reaction.
yeah.
instead of that thing of, I don't want you to come back at me, so I'm going to lay out all this groundwork so that you feel comfortable and you can't get mad at me. That's equally as unappealing as coming at somebody brashly. And when we assert ourselves and we do we express ourselves, we are going to feel uncomfortable. So how can we create safety around that? Having a phone call with a buddy afterwards, or creating some comfort for ourselves, or having a cup of tea when we have an uncomfortable conversation.
Mm-hmm. Yeah. And sometimes learning the trick of talking intimately to someone who has hurt us or has done something that we don't like. I don't know how to describe this place that you can get to in yourself exactly, but it's kind of like a state where you believe the best of yourself, you believe the best of the other person, and you call out to them from your true self, not your I'm going to set you right position, but you call out to them to kind of move with you toward a higher level of communication.
Yeah.
Let's together understand each other so we can, be better friends, so we can work together better. Because here's what happened, and here's how I reacted to it. And then you stay in that place of still seeing the best in them, still seeing them as someone who is reasonable.
Absolutely. I mean, I think it depends on the nature of the relationship. That if this is a relationship that I care about, what I always tell clients to lead with is the intention.
Mm-hmm.
I need to talk to you about something because I care about you. I care about our relationship, and this is getting in the way of me showing up the way that I want to. So I think that that's very important. For my personal situation, this is something I paid for to get a service from, and these people are part of this group, and I don't have an investment in the long-term relationship, which you didn't have that information. But I think that we can show up and work on relationships that are important to us and work through the bumps. I think that's really important. And it's okay in other relationships to say, I need to let you know you're stepping on my foot. It hurts. And I'm not okay with you stepping on my foot ever. Yeah. Did we get derailed? Why don't we go back to some questions?
Okay.
You talk about the crucial importance of a person's inner self connection. Why do you make that idea such a central focus?
Well, first of all, your emotional health has to be nurtured. Okay. It's like health has to be nurtured. Health isn't something that will happen no matter what you do or what you allow other people to do. Health has to be taken care of. And your inner self connection is your personal source of nurturance. It's you, really, it's you being a mature parent to yourself, where you become interested in yourself, you become sensitive to yourself, you look out for how yourself is doing, and you protect that self, even when you're scared to do it, or even when you don't feel like doing it, okay, or makes you uncomfortable, like you were saying. Yeah, that idea is critical because that's what gets lost in the relationship with emotionally mature people, because they are so self preoccupied that they act like it's your moral obligation to set yourself aside and meet their needs. And if you don't, you're being selfish. Sometimes it's like only self sacrifice will, meet the level of attention that they need. And you can end up feeling very bad about yourself for not supplying that, which is
right.
Really not good and not realistic. But having your own self connection is also essential as the basis of you living as an adult in this world. For you to have a mind of your own, for you to have a heart of your own, where you decide who you really love and you decide who you want to hang out with and who you don't, right? And so developing that sense of self gives you that core around which all the other parts of your personality revolve. It gives you a sense of autonomy because you kind of have your batteries included. Okay. It gives you a sense of safety and self trust. Like, if you don't have an inner self connection, you're not in touch with your instincts. And so you can't tell when somebody is safe, or you can't feel when a situation
Mm-hmm.
is unsafe, right? Because the lines are down, the communication isn't there between your instinct and your mind. So the inner self connection, I tell people, if you're dealing with your father or your mother, your spouse, whoever it is, and the whole time that you're interacting with them, you stay in touch with yourself. That is all I care about. You get an A+ from me if you don't do anything else, because these people are so overpowering at times that
Mm-hmm.
you end up separating from yourself in order to get along with them. You end up dissociating, you end up
Yeah.
putting yourself aside, you just blank out. And that is such a disservice to the life force in you. You know, are you going to like not exist because of how they feel at the moment?
Mm-hmm.
So I make that job number one for therapists to work on with their clients and for clients to remember whenever they're dealing with people like this.
Mm-hmm. I think about it in terms of being able to own your own reality. And when we grow up in environments where our feelings aren't validated, we don't feel seen and heard, there's a sense of something's just not right. Or I tell somebody, gosh, that hurt my feelings. And then all of a sudden they're angry at me because I'm so emotional
Yeah,
that, wait, where's my reality in that? And as we learn to identify what we're thinking and needing, and we know that our thoughts and feelings are valid. So if I say that hurt my feelings and you go like, you're just being so sensitive, I can go like, you're having a hard time with my feelings. So based on what I know with my relationship with you, do I just go, yeah, you're right. And I move on, or, but I own that I'm not being offensive to you, that this is what my reality is. And I think that's so powerful. I also was reflecting a little bit about what we were talking about before. And if you are having conflict in a relationship, like with this situation, I've had to do a lot of processing outside of this group situation to get clarity about what's going on with me, which is where having a coach or a therapist or a treasured friend can be really helpful. Because when something activates a lot of our history and we're very passionate, or our feelings are very hurt around something, having a place to process it outside of the relationship, because I don't need to bring my junk to my relationship. If I'm having an issue in our relationship, Lindsay, I want to take that somewhere else to get the big feels and the big stuff that's from my past. I want to get clarity about that outside of the relationship. So when I come to you with whatever it is that I need to tell you, it's pared down to what is happening in the moment and not everything that's happened in my life where I haven't felt seen and heard and hurt. And you know, I'm bringing that to you to fix that wound from when I was 5. I want to keep it
right.
simple and in the moment.
Yeah, great plan. Seriously.
Yeah. So I think our final question, and I'm just monitoring time, is how do these issues affect a person's choices and behaviors in relationship?
Well, it's foundational because we learn the rules of relationships and how we're supposed to be, and all of that from our earliest family relationships. Of course, we have a lot of input from other people later on, thank goodness. But very early in life, if we grew up with an emotionally immature authority figure, we learn that essentially they are the most important person in the relationship. So you don't have the experience of this is a mutual, reciprocal, fair, equally concerned relationship with other people where you have to, respect their wishes and whatever. But basically, everybody's treated as being important, just for being there. Instead, you learn a pattern where all your attention
Mm-hmm.
goes to this other person that feels normal to you. It feels normal to keep your finger on the pulse of that person's moods or their reactions, to do or say the little thing that will tip them toward a better mood, a higher self esteem, more stabilization. It's like an art form. And you learn how to do that in a way that keeps on happening,
Mm-hmm.
so that you have to unlearn that assumption that that person is more important inherently than you are. And that can take a lot of conscious effort to correct that later on as an adult. You also learn to feel like a goal is to be approved of
Mm-hmm.
and to please. We talked about that earlier. But you're doing that because you're afraid of them. When we use the people pleasing thing, we act like it's because we just want everything to be nicey nice all the time. That's not really the most basic motivator. The most basic motivator is we're scared of what they will do or the mood they'll get in if we don't. So we end up learning that you better take other people's reactions extremely seriously all the time.
Mm-hmm.
Okay. And that's not true. I mean, think of how many times in your own life you have a reaction off the cuff and you didn't mean to come back
Mm-hmm.
that hard, or you really weren't that upset, but you kind of lost it for a minute. And when you go back, you're like, it wasn't that big a deal, but your behavior might have cued the other person that, something was terribly wrong. Children have no sense of that whatsoever. They can't tell if they should be taking you
Mm-hmm.
seriously or not. It's just this giant that they're living with is in an ill humor. And like in all the fairy tales, you got to pay attention to that first and deal with it. And so
Right.
people learn to allow themselves to be eclipsed,
Right.
to be ignored, to be overlooked, to be dominated, to be emotionally coerced through shame and guilt and self-doubt and fear. They learn that they take other people extremely seriously and that it's okay for them to be secondary and to be overlooked. Of course, we mentioned earlier the trouble with boundaries that can become,
Mm-hmm.
second nature, like just easier to let them have their way or, have more contact than I want to give
Sure.
because it's so unpleasant when I set a boundary. Yeah. And we're taught to be kind of passive and helpless
Mm-hmm.
because that's what tends to calm down emotionally immature people.
Yep.
Like you do what I want and you don't exert any power, we get along just fine.
Yep. I call it go along to get along.
Yeah, exactly. Yeah.
Yeah.
So you learn how to take care of people that have a low stress tolerance
Yep.
and you learn to take them really more seriously than you should. Because just because they have a big reaction doesn't mean that you should change your preferences and your behavior.
Yeah, absolutely. Lindsay, we are running out of time. This has been just delightful. Is there anything in closing that you want to say, or where can people find you? I read about the books that you have in the intro, and they are in the show notes. If anybody wants to get Lindsay's books, they're amazing. I highly recommend them.
Thank you. Yeah, they can go to my website, which is Dr. Lindsay, Lindsay Gibson.com. And you can find more information. There's some writings and information about the books on that.
Right. You are just doing amazing things to help change lives. I just appreciate you so much and the work that you're doing.
Oh, thank you. Right back at you. I love your program.
Thank you so much, Lindsay. Have a great day.
Thanks. You too.
Hey again. I'm curious to know what you thought of this episode. How much of it did you relate to? The things that we talk about are such common themes that I see clients coming to me with all the time. And how do you manage if you have a parent, a sibling, a friend who doesn't respect who you are, you don't feel seen and heard? What am I thinking and feeling? How do I learn how to express myself? How do I set boundaries? All of the things that we talk about are really common for the clients that I work with. It's that intersection that I talk about of wounding and being highly sensitive. And I really haven't met anybody who doesn't have some level of wounding, which is why I share so many of my personal stories on this podcast. I want everybody to know there's nothing wrong with you. We all struggle. Healing is something we're doing for forever. And things can get exponentially better when we find out that we're not alone in this and we work on some of our healing so that we really can thrive as sensitives, as creatives. If you're struggling, if any of this resonated with you, feel free to reach out to me at unapologeticallysensitive.com. I'm doing coaching right now. I can work with people internationally. I found a framework that seems to be pretty effective with People, if you have any questions, feel free to reach out to me. I love hearing from you. You can reach me at unapologeticallysensitive@gmail.com. I hope you're doing well. I hope you're thriving. I hope you're finding some beauty. If you're struggling, that's okay too. It's okay to not be okay. All of your feelings are okay. You are enough. You are okay. And this is just how it is for right now. Remember, sensitivity is nothing to apologize for. It's our superpower. Have a blessed day.